Hi there, Rockwall County. I am Darby Berkey with the Rockwall Chamber, and I want to thank you all for joining in with us today on another episode of The Pulse, as we connect with our local leaders on timely topics. I also want to thank our 2020 Luncheon Series sponsors and our elite chamber investors for allowing us to continue offering you relevant programming during this time. It's because of those and all of our partners that we are able to continue to do these things for you. Wanted to give you just a couple of updates with the Chamber. We are going to be having our annual State of the City at the end of the month with Mayor Jim Pruitt and Rockwall City Manager Rick Crowley. We've also got our next episode of The Pulse coming up next Tuesday with City of Rockwall's newest council member, Anna Campbell. So we'll be visiting with her next Tuesday afternoon. I also want to let everyone know that for the fall, we are planning our clay shoot, and we have combined that with our golf tournament to be rebranded as a 2.5-day event, The Iron. We look forward to seeing you all there as we round out the end of the year with a great event. I'm going to turn it over to our chairman of the board for 2020, Ms. Katie Miller, so we can get the program started today. Thank you for joining us.
Good afternoon, Rockwall County. We are so excited that you're joining us for this episode of The Pulse. It is my pleasure to serve as your Chamber's chairman for the 2020 year. And we are so privileged today to have two folks who have been working to the grindstone on top of their regular jobs to keep us safe during this pandemic. I'm going to go ahead and jump right into it, and it is my pleasure to introduce Cindy Perrin, President and CEO of Texas Health Presbyterian Rockwall.
All right, one would have to unmute their mic to be able to be heard correctly. Can you hear me?
Yes, Cindy, we can.
All right. Well, thank you for having me today, Katie and Darby. We appreciate being invited to participate in today's update. We don't ever want to miss an opportunity to let everyone know what a privilege we believe it is to provide healthcare for our friends and neighbors and all of our surrounding areas. But we don't take lightly the fact that along with that privilege comes the responsibility to help educate and help clarify, especially during times of pandemic. And so that's hopefully what we can get accomplished today. We know there's a huge amount of information out there, and some of it is misleading. Some of it is just downright confusing, and some of it is pretty legit. So would like to walk through some of those things. I know I'm asked a lot this past couple of weeks. They hear people tell me that they've heard, oh, we hear the hospital is really full of COVID patients. And I try to help everyone understand that we do have an uptick in our COVID patients, our COVID population. We have 60 beds here at Presby Rockwall, Texas Health Rockwall. The exciting news is we are in the midst of, we have actually started our expansion project where we're adding 2 floors and a huge number of beds and new service lines. The bad news is we didn't start that 10 years ago before the pandemic decided to hit us. So we're working through that, but we're here. We're here to continue taking care of our community, and we want to be here to get us through to the other side of this thing that we're experiencing right now. So I want to clarify a little bit about what our current state is. When we say that we have a surge capacity here at our hospital, it's not unlike the other hospitals in our Metroplex right now. We hear from all the hospitals in our system of Texas Health Resources on a daily basis, and we appreciate and enjoy the support of the whole system throughout the Metroplex to help us as we keep moving forward. Some people want to know, what does it mean to be under surge capacity? That means that We've actually seen a large increase in the number of COVID patients. And just to put a couple of numbers to that, so you get a feel for what I'm talking about, at the beginning of May of this year, sort of around the start of what we started noticing admissions to start climbing, we were seeing about an average of 5 patients a day come to our hospital and need a bed, need to be admitted to the hospital with their symptoms. Today, as with the last couple of weeks, we are seeing on average of was 30, and now we're up to 35 per day. So when we start looking at that type of increase, we start moving some of our operations around here in the hospital. We have added walls in some of our waiting rooms so that we can provide social distancing and meet those guidelines to keep everybody at least 6 feet or greater apart. We have returned to a visitors by exception policy, which means that does not mean no visitors. That just means that we want people who really need to be here in a visiting capacity to have the opportunity to be here. And those visitors would be for the elderly patient that we might have that is confused, that would benefit from having their family member be with them continually. It might be one of a patient that is getting a devastating diagnosis that needs to be in the company of a family member to receive that and have the support of family as they receive that diagnosis. Certainly, if there's a child involved, both parents would be visiting with that child and be in attendance. And certainly on our women's services unit, new fathers are constantly in attendance with mom as we go through and bring new life into the world. So it's not that we're not having zero visitation. It's just that we're trying to keep that number to a minimum. So why are we doing that? Why do we worry about how many visitors we have? It's all about trying to keep everyone safe, not just our patients, but also our caregivers that work here, because it is very clear that as we keep navigating through the pandemic, it is going to take each and every one of us to be healthy and be able to be here every day to provide the care that needs to be provided. And so if we can keep interactions to a minimum, keep the traffic down inside our building, even though we're all in masks, everyone that comes into the building is in a mask, and we do believe that that masks work. It is shown that just interactions should be kept to a minimum. We shouldn't be gathering in large groups. And we should be keeping distances from each other. So that's the reason for our visitation policy as we currently have it. As some of the questions started coming out last week about our surge policy, the barricades went up at the front door. It was great timing. It was much like a perfect storm. I walked out on Friday afternoon, and the whole front door was barricaded off with some lovely green signs saying, "Visit our side entrance" for the front door. And I want to clarify, just because we're functioning under surge does not mean we're not providing all the same kind of care that we were providing before that. Our emergency room is still open. We are seeing increased numbers of COVID patients in our emergency room, and a large number of those patients do get to go home from the emergency room just because their symptoms are not bad enough to be in the hospital. And I'm asked occasionally, well, do you let positive COVID patients go back home? Well, the answer is yes. If they don't need to be, if their level of illness doesn't require them to need a bed in a hospital, the best place for them is back at their home, self-quarantining away from even other members of their family. So yes, we do allow positive patients to go back home. With the understanding and immense education and instruction pamphlets that let them know what that self-quarantining means and what the expectation is for that. The last time we were under surge capacity, this is another question I've gotten recently. What's another comparison for the last time you had surge capacity? Well, the thing that came to mind immediately was back in December of 2016 when the tornado came through, tearing through Rowlett, and Lake Point Hospital was pretty much in its path as well. And I think some of their power was knocked out, and it threw us right into the service of trying to help nearly 100 people that all hit our ER within the hour, and needing care, some of them very, very emergently. Our surge plan went into capacity to effect that night, and that meant we called in people that were off, people that there are so many of us that live here in this area that we could respond very, very quickly. But we doubled the number of caregivers that we had when that started within about 30 minutes. And we were able to take care of all of those patients and get them either in a bed here in our hospital or get them to a higher level of care if they were going to need some higher need that they had. We are currently continuing with our surgery schedules. That's another question that I'm getting. We do limit some of the elective type procedures right now, just because we want to be able to have beds open for the number of patients that come to our ER. We don't have a crystal ball on how many patients that's going to be on any given day to come through the emergency room. And our goal, of course, is to always be able to take care of those patients that come in there. So one of the ways we do that is to limit elective types of procedures that might otherwise need a bed as well. People ask, what can we do to help you right now? And I think one of the major emphasis points that I want to make is that it's a very simple recipe. It is to follow CDC guidelines right now, understanding that we are in a surge and we're going to be in a surge for a while. We don't know when the end is going to come. We hope that would be with the creation of a vaccine. But until that point, we need to be ready to care for as many people as we possibly can. What you can do to help with that is to limit your exposure to others. Stay out of big crowds. Wear a mask. Practice really great hygiene. Wash your hands. Don't put your hands on your face or your mouth or rub your eyes. And that's very, very difficult. The more you think about not rubbing your eyes or touching your nose or not touching your face, the more you're going to want to do that. So it's a little bit funny. Sometimes people will be saying, don't touch your face, and they're actually touching their face while they're doing that. So, but it's very, very important. And why is that important? It's because we know this virus, one of the things that we do know about the virus is that it is spread by contact. It's spread by droplet contact. That means if someone sneezes or has touched their mouth or their nose, and then they touch something that you touch, and then you touch your mouth or your nose anywhere around your mucous membranes, the virus is spread that way. People don't have to just sneeze in your mouth or cough in your face. It can be spread on the tips of your fingers, very, very simply. So hand washing, nothing beats just soap and water hand washing. If you don't have access to soap and water, I believe a 60% or greater content of alcohol hand sanitizer is what is recommended right now by CDC. That's about all I've got, Darby or Katie, unless there are any questions.
Cindy, thank you so much for that update. I would be remiss if I didn't stop to say thank you personally to you and all of your caregivers there at Texas Health Rockwall. The work that you guys are doing is incredible, and it's so much more than what we typically view as healthcare, right? Delivering babies and replacing knees, and And you guys are doing really hard work right now, and we know that that is taxing for your team. And so we are just so grateful that you guys choose that profession for our community. So thank you, and thank you for all of your caregivers there. I do have one question that came up that would be more appropriate for Cindy real quick. How many, you mentioned that people who come to the hospital may be tested, and they may be tested positive, and then they're sent home. About how many would you foresee are sent home versus are admitted?
That's such a fluid number. It just truly depends on their condition when they are ready to either be dismissed or admitted. They may get here, and we can treat them to get them to a level where they can go home. Certainly home's always better, unless they're having shortness of breath to where they need pretty continuous oxygen or higher level of assistance with breathing. So that number fluctuates very, very greatly. On average, I can tell you that for every 5 people that show up in our emergency room, for a large portion of the day, meaning for around 12 hours a day, we see that probably 3 out of 5 of those people need to be admitted.
Wow. That's incredible. Okay, so with that, I would like to introduce County Judge David Sweet. He has been poring over these numbers consistently, seems since March, February. I mean, goodness, it seems like since the creation of time at this point. So, Judge, why don't you jump into your content, and then we'll merge you and Cindy back together for discussion.
All right, that's very good. Well, thank you, Katie, and thank you to the Chamber, Katie, Darby, Sean, for hosting this very important update, and I'm proud to be part of this. And I do know that this has been an extremely tough and trying time for everyone in our community. I've said this numerous times that everyone has been impacted either directly with this virus, either has become ill, suffering from it, or has loved ones, family members. There's a high level of unease, a high level of concern for everyone in our community, and obviously it's had an economic impact on everyone. So we're extremely sensitive to that, extremely concerned about that, and just want to thank everyone for, first of all, I'll thank the hospital, thank Cindy and her team over at Presbyterian Hospital of Rockwall. Of course, we're good friends with Baylor Scott and White Lake Point, as well as our the emergency room, the emergency Baylor facility over off Interstate 30. Thank you for what you guys are doing. I know it's been extremely tough and trying times for y'all, and just know that we're praying for you and we support you. I want to echo something that Cindy said a moment ago. I do want to reference and mention again, as she said, they have chosen at Texas Health, Presby here in Rockwall, to in managing the flow and managing the uptick in cases, that they have individually chosen to cut some of those elective surgeries, but we're not under any of those restrictions here in Rockwall County. The governor made a decision to restrict some of the larger counties, and that expanded over the last few days into some other counties, but Rockwall County is not under that. And I saw that Cindy, you and your team had shared a Facebook post earlier this afternoon that I thought was extremely important. I saw some of that referenced on Fox 4 this morning in a visit with the ME, medical examiner down in Dallas, and he had mentioned the fact that an uptick in folks because of concern with the coronavirus that have significant levels of hesitancy at going to the hospital. And I want to make sure, and I'm sure you'd agree with me, I saw the social media post, and when Cindy comes up here in a few moments, we can back together reiterate that point, that that's not the case. We want to make sure that folks understand that when in need of care, please don't hesitate to go to the hospital. I want to kind of touch on for a moment, touch on some of the things, the high priority items, if you will, for my office as well as the Rockwall County Office of Emergency Management. And I identify them as the big four, and this list grows every day. And I always joke with our emergency management coordinator that when I say these four, she's like, well, what about 5, 6, 7, and 8? I understand, but these four have proven to be the case since the very beginning, and they'll be of high priority out of this office as we move forward. Number one, that would be data. It's so extremely important, and I know that accurate, reliable, and timely data As far as cases are concerned, obviously the conditions as far as our hospitals are concerned here. Tell you a little bit about the way that case information is brought to my attention, or how the information that we're able to share on the county's website and that we're able to share on our social media site. Rockwall County is supported by Region 2 and Region 3 of the State Health and Human Services from the Department of Health. Region 2, Region 3, they serve as the county's health department, along with 39 other counties in North Texas. 254 counties in the state of Texas. There's only 60 counties that have their own individual health departments, and that's really not a good snapshot, because it's actually smaller than that in terms of individual health departments just for that county. There's all kinds of relationships that make our cities and counties that make that up. But again, we're supported by the Department of State and Health and Human Services, Region 2, Region 3. And they, at the very beginning of this, when cases were reported to them, they reported that information as far as numbers are concerned to the county health authority. Then he relayed that information to me, as well as the address information to our dispatchers here in the best interest of protecting our first responders. And then, of course, that's the information relayed out to the public, and that's the total case information that you saw. The department made a decision a couple of weeks ago, or I guess it's a little bit more than 2 weeks ago now, to go to the Texas Tracing Group, just dump all of that information into that website, and then that's how we'd be directed to that website to be able to get that information. We had a high level of concerns. I had a high level of concern with that, and reached out to leadership in the state level, the Texas Department of Emergency Management, and the Department of Health and Human Services, and they understood the importance of what my concerns were. And we've gone to, here in Rockwall County, they're calling it a pilot program, and that is they're relaying that line list directly to us on confirmed cases, and then we're going through, working with our GIS coordinator to ensure that those are Rockwall County addresses, the accuracy of the information that's been reported to us, and then we report that each. And if there's been a significant high level of challenges, or there's been a significant level of challenges in relation to stuff that's been included in that from other cities and other counties, but we've got that worked out now. And so the information we receive that information Monday through Friday. We work on ensuring the accuracy of that information. Then we're reporting it to our website and then to our social media site. I'll touch on that right now. The most recent update that we updated, and we'll have another one that goes out this afternoon. But most recent update: 513 cumulative confirmed cases of COVID since the very beginning in Rockwall County. There's 95 estimated active cases, 401 estimated recoveries. There are 17 fatalities here in Rockwall County. And again, one's too many. But 17 Rockwall throughout the entire county. 15 of those, of course, were out of the outbreak earlier over at Broadmoor, and then we've had one out in Fade and one out in the unincorporated portions of the county. There's been a little bit less than 7,200 tests that have been administered to Rockwall County, and the most recent update, based on yesterday's information from another report that I'll touch on in just a second. 40 people in Rockwall County admitted with confirmed COVID-19 cases into, again, Rockwall County hospitals. So let me speak to another report that we pay attention to, is the EM Resources report that comes out every day, and that's a snapshot of all of the hospitals in our region. You can come up with a drop-down menu, and we can see what's going on from a regional perspective, and then we can break it down to each and every county. And that information is based on what the hospitals are able to key in and report every day. And again, as she said a moment ago, with some of these cases, with some specific individual questions as far as some of that data, it's also very, very important to remember that it's fluid. But it changed a lot. It changes a lot. But most recent information was that keyed in this morning was that there are 205 patients that are in Rockwall County hospitals. There's 100 beds that are available. That's a 67% occupancy level. There's 62% occupancy level in our ICU beds. 52% ventilators were in use. We've had 35 confirmed COVID cases or individuals, patients that are in Rockwall County hospitals. And that report is extremely important, obviously, for us to be able to get a snapshot to make sure that we understand what's going on in our hospitals. And that's when we're on our conference calls every day, and we make sure, we're on a conference call quite a few times a week, basically. And we reference that as far as our conversations are concerned with the decisions that need to be made locally. But all that to say, number one priority, again, accurate, reliable, and timely information that we needed for ourselves, decision-making wise, and be able to understand what's going on throughout the county. But I understand that the residents need that. We want to make sure that we're able to report that. Availability of public testing is another big one. Through our partnership with the Texas Department of Emergency Management, the Texas National Guard, and Lake Point Church, our Office of Emergency Management has been extremely successful in securing public testing. And on a day-to-day basis, that's been the number one visited testing site overall, and week by week number. Excuse me, let me correct myself. I'm sorry. Week in and week out, that's been the number 2 visited site in all of this region, and total, it's been the number 2 site. Some folks have backed out. Another county had backed out as far as being able to host tomorrow. So we jumped in there and we were able to secure it. So there'll be public testing available over at Lake Point tomorrow. Folks that are interested in registering for that test would go to Texas, spelled out TEXAS, Curative, CURATIVE, Inc.com. One more time, TEXAS.CURATIVEINC.com. But it's interested in registering for testing that will be available tomorrow, again, over at Lake Point. Encourage you to take advantage of that. I'll also point out a couple of other places here in Rockwall County that we know are providing testing, and that's Rockwall Urgent Care, My Labs Direct. You can check out their website, or you can call 877-355-7978. And then Rockwall Drug and General Store is working to get online. They should be able to provide some testing next week. We'll continue to share that information on the county's website, as well as the Office of Emergency Management Facebook page here in Rockwall County. Another area of focus since day one is ensuring that we have the proper levels of personal protective equipment, PPE, for first responders in Rockwall County. And at this point, we've been working on this since day one. It was a big challenge right out the gate in early March, and we're still continuing to make sure that we've got access to that. And we had 10,000 surgical masks that were made available from the Texas Department of Emergency Management to Rockwall County. We make sure we've got those. If there's physicians or dentists or anybody else in the medical field that has those needs, I want to encourage them to check in with Rockwall County Office of Emergency Management. They've got tons and tons of sources, and we'll make sure that we're able to get you in contact with those if needs arise. And then the last thing that I wanted to touch on also is I've identified this as red hots, and that is, we had the big outbreak over the Broadmoor Senior Facility. As a result of that, we've made sure that we have a list of all of the long-term care in the senior facilities here in Rockwall County and our Office of Emergency Management. Make sure we're in constant communication with them to make sure that we understand what's going on in each and every one of those facilities, to see if there are some needs that they have that we can assist them in. We've been able to do that. We've had to work with Texas Department of Emergency Management to provide some public testing for facilities-wide testing in a couple of those facilities, as well as we've been successful in obtaining decontamination into the facilities here in Rockwall County. That will continue. We will continue to keep in contact with those facilities and provide those updates and send those folks to be able to provide the assistance, or who those folks need to reach out to get the assistance that they need. We've added daycares to that. We had a few weeks ago, we had the incident over at one of the daycares here in Rockwall County. We've added them to the list. We're in constant communication with them. And also making sure that they know their licensing organizations who they're able to contact if assistance is needed. Katie, what I'd like to do now is if there's any kind of questions, we'll bring Cindy back in here and we'll answer any questions that folks have. Thank you.
Thank you so much for providing that update on numbers. I know that data is incredibly hard to, one, obtain and then two, scrub for accuracy. So thank you, Judge, and to the Office of Emergency Management for doing that hard work for us. We do have a couple questions that were presented in the chat and then sent via text message. You know, Judge, you mentioned or you reported that there are 401 estimated recoveries. Can you clarify what the process is for someone to be deemed recovered and what that looks like?
It's unmuted. There we go. Very simply, you know, that information is sent to us from the Department of Health and Human Services. That's based on when the person has come out of quarantine, if you will, and there's a little bit of touch back and forth. They do check. The Department of Health and Human Services does check in with those folks to see what their status is.
And then a follow-up question to that: if someone was tested and they tested positive, excuse me, not positively, it's not a positive thing, and they tested positive, and then they go back for a subsequent test and they test positive again, are those counted twice in our numbers? No, that's a very good question. I've had that pop up quite a few times. They are not reported twice if somebody is retested. Perfect. And then another question that we've received, you know, we talked a lot about how many beds are available in Rockwall County, but can you share how many vents are available in Rockwall County? How many ventilators?
Bring that one to me. Let's see if I can tell you specifically. Cindy, I'll look at the specifics. I said a moment ago that 52% were occupied. You want to speak to vents and?
I can speak for.
Muted.
Can you hear me?
Can you unmute her? I'll look at that.
Hello?
There.
Okay. I can speak for our hospital. I don't have any idea how many are in the entire county, Judge. Here at Rockwall, we have a variety of different types of ventilators. We have 8 that we use on the inpatient side, but we have several others that we use in our emergency rooms, both North Rockwall and main campus here, depending on what level the patient needs. And then there are BiPAPs machines as well, but I'm going to have to pass that back to you, Judge, for the total for the county.
Yeah, good call out. That was kind of where I was going, though, was the fact that there are other, as you mentioned, CPAP, stuff like that you guys use. But as far as the total is concerned, that 52% of ventilator usage in Rockwall County, there are 12 that were in use when this report was created, with 11 available.
So we've gotten another question, but I think we were able to answer it. Someone asked if someone tests positive for the virus, will they again test negative in 2 or 3 weeks, or will they show positive longer? What I'm thinking is that's more of a clinical question about how long you may be able to test positive, like what duration you can test positive for. So I'll turn that over to Cindy.
We see varying results from that. Some people, it just depends on where they are in their virus shedding part of the disease. Some people shed faster than others. Will they test again negative in 2 to 3 weeks, or will they show positive longer? Some people do show positive longer. We've had people show positive past 6 weeks.
Wow, that really is incredible. And they're still exhibiting symptoms at that time?
No.
Wow. Okay.
And it's unclear as to whether they're still contagious. Another
Which
one
goes
is,
back to your point about why the social distancing and the mask are so important when you're in kind of confined areas and interacting with others.
right.
So that's all for the questions that I've received. Is there anything that you guys would like to say as a final word? Judge, I'll let you go first, and then we'll turn it back over to Cindy.
All right. Well, thank you very much. I just want to, again, the most important thing that I can get across is for emphasizing again that I know that this is an extremely, extremely tough time for everyone across the board, period. And folks are rightfully concerned, and I want to encourage folks to do those things we mentioned a moment ago. Cindy talked on, and Katie, you reminded us there as far as that social distancing is concerned, and wearing masks and being careful in terms of the places that you go. And encourage you to do those things, as well as to make sure that you're ensuring that you and your loved ones taking that personal responsibility as individuals and family members, how important that is. I want to encourage you, though, if you're sitting at home and other health conditions, or you're suffering in any other ways, do not hesitate to go to the hospitals. The hospital conditions are here, as Cindy has said. These numbers, you can't avoid that in terms of realizing what's going on with COVID. Worldwide, a national pandemic. We've seen these state numbers, and we've touched on what's going on in our hospitals. But don't hesitate. Do not hesitate at all. If those again, I mentioned that earlier, there are no restrictions as far as services are concerned. These hospitals our local hospitals are on top of things. And they are able to manage these loads, and we do want you to go to the hospital. Our commitment, as I mentioned a moment ago, here in Rockwall County, is that we'll continue to search, and we'll stumble along the way, but we'll recover, and we'll make sure that we're getting accurate, reliable, and timely information out to you. We'll continue to make sure that we pursue public testing. I know that that's a big concern. That continues to be one of the biggest concerns that people have. I've had 4 or 5 texts today. Hey, where can I go to get a test today? And I get it. We'll make sure that we continue to do our part in seeking public testing, and when those are available, that we'll make sure that we're able to communicate that to you. We'll stay on track with the PPE thing. I think those needs are very clear. That's not going to go anywhere anyway, go away anytime soon. And then, as I said before, we'll make sure that we're touching base with our long-term care senior facilities here, as well as our daycares. And then if anything else pops up that we need to make sure of through these ever trying times. When the example, when your question in terms of how long somebody was ill, or how long that they would be showing positive signs to Cindy a moment ago, and we were kind of wowed with that answer. I think that reiterates again that while there are a lot more known today than there was a few months ago, there's still a high level of unknown. And so we want to stay on top. See that head shaking from one that's got a seat right up at the table there with Cindy. But I do want to remind folks that that's still the case, and that when I have conversations with folks that have been in my role, or municipal roles, or county roles throughout the state of Texas, that there is not an expert on our side of the table. We've gone through this in over 100 years, and there's not a textbook that we can get a hold of that says, hey, this is the case. This is what's going on. So, but that does bring up to one other thing that I want to say, and then I'll hand it back over to you. Is that early on we created a task force here in Rockwall County. I did this out of my office. We've got representatives from each and every one of the cities that works with us, and they're making sure, or one of the things that they've kind of worked on is that we're working on a study to make sure that we're able to capture this information. We'll be able to slide a sheet in that kind of shares what our experiences were throughout this whole ordeal. That when we run into a situation of this nature in the future, that we do have something, we'll be able to identify some of the things that we learned and some of the things that we were successful at doing. We have a conference call. We do that on Mondays and Fridays now. That join us on that call, and that's made up of county representatives from all of the cities, the 2 school districts. Both of our hospitals join us on that call, as well as the health authority, and representatives from Representative Holland's office and State Senator Bob Hall's office, and go through and engage and hear from each other some of the experiences that we've had throughout the week, and touch on both the hospitals mention what they've seen and what's going on. And it's very interesting, and that will continue. But just want to encourage folks to be safe and to hang in there, and we'll get through this together. It's one of my favorite things. I've always talked about that spirit in Rockwall County. We've been punched and we've been knocked down. I have utmost confidence that in this county that we'll get through this, and we'll come out strong on the back end. But thank you, Katie. Thank you, Darby, for hosting this, and then also thank you, Cindy, for everything that you and your team are doing, as well as Lake Point is concerned. And I know you're pointing at me. Where's that at? Here we go. I do want to mention this. Darby, it's not to me. Our other hospital here, Baylor Scott & White Lake Point, was unable to join us on the call, but he did have Donna Scola, the president of Baylor Scott & White Medical Center Lake Point, did have something that he wanted to make sure that we convey. And that says, as the number of COVID positive cases continue to rise, we stand ready to meet the healthcare needs of those that we serve. It's important to note the vast majority of patients treated in our hospital since March have been receiving care unrelated to COVID-19. We know many people have put their health on hold over the past several months. Reiterates exactly what we've spoke. Our point is to go to the hospital. And our Safe Care Plan is designed to protect the health and well-being of our caregivers, our patients, and provide our communities with peace of mind. In an effort to inform our local communities, we have initiated an advertising campaign highlighting our safe care measures. We're proudly featuring real Baylor Scott & White health caregivers and patients in this campaign, as they're the heart and soul of our organization. Baylor Scott & White will continue to do what it takes to meet the healthcare needs of our community. And Darby, I think you've got a video that we're good. So, okay. But again, thank you to Donis and his team at Baylor Scott & White Lake Point. And thank you to Cindy and her team for what you're doing. And know that we're supporting you and that we're praying for you. And thank you.
Absolutely.
Cindy, do you have any final words you'd like to share with us?
I do want to encourage everyone to understand that all the hospitals here, we are all standing ready to care for you. And it is very, very important to understand especially if you're in need of emergency care, if you've got a broken bone, or if you feel like you're having a heart attack, or if you feel like you're having a stroke, please, please do not drive by any hospital because you think they have too many COVID patients, or because you think they don't have time for you. I can assure you absolutely that the best place for you, if you're having a heart attack or a stroke especially, is getting to an emergency room that is the absolute closest to you, because we all have a clot busting medication and we all have heart medications that can either open up your heart vessels and save your heart muscle, because we're not lizards, we don't grow back these things as humans. Or if you're having a stroke, we can start a medication on you that will dissolve the clot that is keeping that would potentially prevent you from having lifelong paralysis after a stroke or worse. So please, if you take nothing else away from this discussion today, our emergency rooms are open. Our staff is fully welcoming everyone. That we are here. We're open, even though the barricades are at our front door right now, because that's where they're starting our. It's crazy. There are no barricades around at the back door around the emergency room. So seriously, that is a very, very important topic, because I don't think about people driving by very much, just because I am a nurse, and I understand that I need to have some physiology background and so forth, and so. But Judge reminds me frequently that some people, might not think that way. And please, please do not drive by your closest emergency room, be that whatever emergency room you're closest to. And lastly, I want to close by saying how important that we all know it is to try to keep a vibrant economy going. We are fully supportive of, when I say to you, don't gather in large crowds, I don't mean don't go support your local economy. I mean, try to keep a 6-foot distance from everybody that you're going to come in contact with, and keep a mask on if you're going to go be in contact with people. We can coexist with this demon that we're working with right now. That's my new name for this virus, by the way. We can coexist with it, guys. And we know simple things that combat it. But it doesn't mean we have to shut down our economy, and it doesn't mean we have to hibernate away. It means we have to find that fine line between, and this is part of it. Okay? So those are my 2 takeaways.
And you bring up such a good point, Cindy, about how do we balance being safe, but being proponents of our local economy? How do we continue to shop locally in a safe way? And, I will just commend the chamber staff for thinking of innovative ways to continue to do that during this time. If you guys listening are not already tuned into the Facebook page called Rockwall Restaurant, Retail, and Entertainment Resource, this is a great resource for you to find out who's offering curbside pickups, who's selling their goods and services online. How can we, as small businesses, connect with each other to continue to grow those businesses? Cindy said that we need to, and we can find a way to live with this. And the very simple fact is that we have to. Right? We have to find a way to coincide and to live with this pandemic, because while I would love to wiggle my nose and make it go away tomorrow, I'm just not that magical. And I don't know if anybody else is here, or else hopefully they would have done that already. So continue to shop local, continue to support your local businesses, even if it means driving across the lake or, across the bridge to get to Heath when you live in North Rockwall, or South Rockwall to get to North Rockwall. Our businesses, these are our community members, they're our friends, they're in our churches, they're in our mom groups, and they need us right now. So continue to shop local. And Cindy, Judge, thank you both for so much for all that you're doing. We know that this is not easy work, but it's a load that you choose to bear because of your position. So thank you. Thank you very much.
Absolutely. Thank you all so much.